Hello, everyone. Welcome back to day 2 of ChicagoCHEC's 5th Annual Community Forum. To recap, yesterday we talked about social justice issues, community and patients' perspective of cancer care during COVID-19, and the accomplishments of the ChicagoCHEC partnership over the past 5 years. The recordings for yesterday's events can be found on the YouTube page or on the forum website. Today, we will focus on health and well-being for those touched by cancer and the use of telehealth during COVID-19. My name is Selena Roque, and I will be emceeing the event today. We're going to give folks a few minutes to trickle in, and then we'll go over a few things before getting started. Just a little bit about myself in the meantime. I am most recently a ChicagoCHEC Fellow and participant of the 2020 Summer Fellows Program. I am a former performing artist and Pilates instructor, and currently I am a nursing student at Malcolm X College. At this time, I believe we'll go over a few ground rules for the day. Okay, so you have been muted upon entering this event. We will unmute the audience during our Q&A sessions at the end of each session. To submit your questions, you can either post them in the Zoom Q&A box, we'll go over where that is shortly, or you can use the raise your hand feature at the bottom of your screen. If you are joining the live stream through YouTube or audio only, you can also submit your questions at our Facebook page. It is facebook.com/ChicagoCHEC. Friendly reminder that this event is being recorded, so your image or name may be used in those recordings. And now those Zoom functions that I mentioned. In your bottom left of your screen, you will see a microphone. You can use that to either mute or unmute yourself before speaking. We have a chat box next. You can use that to access any links that we post, or you are more than welcome to post links yourself in order to share resources with one another. The raise your hand feature is there also. You can use that to ask a question. If you prefer typing your question, we have the Q&A feature also. And then lastly, we have interpretation. So you can use that to select interpretation in either English or Spanish. Perfect. So it is my pleasure to introduce to you Juan Salgado, Chancellor for the City Colleges of Chicago, for opening remarks.
Thank you, Selena. So good to see you, to know that you're thriving as a student at Malcolm X College. Hooray. That you're entering into the nursing profession soon enough, because boy, do we need nurses, the most caring nurses. And we know that Malcolm X College and city colleges and, you know, the students at city colleges, your colleagues like you, just amazing people, right? Amazing people.
Thank you so much.
And so good to see you. You know, and thank you for the invitation. You know, I think I've been, you know, present at most of the annual gatherings that ChicagoCHEC has had, even before I was Chancellor, but certainly I prioritized that in the time that I've been Chancellor. And I really enjoy being with you. I wish it could be in person. It is not, but this is a very good alternative. The important thing is the work continues to progress forward. We continue to progress forward. And as many people across the country have come to realize, you know, over the last many months and over this 2020, this extraordinary 2020, you know, we've been living with these deep inequities in race and poverty, and the real consequences of these deep inequities have always been present. ChicagoCHEC has been in recognition of those deep inequities that are the difference between living and dying, between having a longer life or not having as long a life. And so, but we all know and we all realize that this moment has really laid stark the differences for some versus others, and the unacceptable reality that needs to change. And we see in cancer similar patterns. And as I've said earlier, I really appreciate that ChicagoCHEC has been at the forefront of tackling these disparities in a meaningful, deep, and systematic way, and in a way, that works with many institutions, but also many generations, right? And that's important at this time too, bringing people together across institution, but across generation, across difference, whether it's in age or race or geography or any other difference that might exist. We should be celebrating those unique aspects of our human capacity rather than trying to be a singular type of person or individual. But through this respectful and meaningful collaboration with community partners, there's been a real effort to design these educational opportunities to promote cancer awareness, to encourage that community residents follow up on what is recommended, right? And we all need encouragement. We all need support. We all need trusted cancer support groups. We all need to hear from people that have experienced something in life that we are experiencing now, so that we can draw from their strength, we can draw from their experience, we can draw from their lived knowledge, and we can draw from their present day inspiration. And I really am, when I think about my early work, which is my continued work in community development, that is the essence of a beloved community, one that comes together, one that listens and honors the people around them, and one that draws from the strength of the people around them. And so I want to really commend and recognize the partners, the Robert H. Lurie Comprehensive Cancer Center at Northwestern University, the University of Illinois Chicago, Northeastern Illinois University. The leadership that has been demonstrated here is, phenomenal. And the commitment to educating and training and mentoring a diverse healthcare workforce for the future is absolutely essential. Seeing someone like Selena taking leadership roles within ChicagoCHEC is exactly what we need to be doing more of. And, I want to just keep lifting up the fact that we have an incredible School of Health Sciences, incredible School of Nursing at Malcolm X College, a place where students learn not just to enter into the industry as the best trained professionals, but also get the benefit of an incredibly diverse environment to meet people from all across the city and all across the world that are interested in entering into these careers. And so, I want to remind everyone that as city colleges, we're really stepping up to the moment. We're the lead partner for the contract tracers in Chicago right now. So we're playing a meaningful role there. We're just about to launch a new mammography basic certificate program for those folks who want to gain skills in this critical role in diagnostic screening and cancer detection. And by the way, it's a program that's, welcoming clinical partners. So if you know of folks that are out there that want to give students an opportunity to learn and grow and advance, we'd really appreciate the involvement in that as well. Really, at the end of the day at City Colleges, we're committed to serving our communities in the same way that ChicagoCHEC is committed to serving the communities. That's why the alignment here is so important. We're committed to growing talent that already exists in our neighborhoods in the same way that ChicagoCHEC is developing talent. We're committed to ensuring a more inclusive, equitable, and healthy Chicago in the same way that ChicagoCHEC is. And so, count me in. I don't need to come welcome every year, but I do want to be a part of ChicagoCHEC. We want to continue at City Colleges to help sustain and grow and ensure that ChicagoCHEC's work continues to thrive well into the future. And so I appreciate the invitation. Welcome today. And Selena, I think I'm turning it over to you.
Yes, thank you so much. Thank you. Oh, sorry,
Juan,
go ahead.
hi, Juan. This is Henrietta.
Hey, Henrietta.
On behalf of the CSC, we're really grateful. You are an integral part of our forum. This is your 5th year. This is our 5th forum. So we look forward to seeing you next year también.
I was trying to remember whether I'd been to all of them, and
Yes.
The answer then is yes, I have.
Yes, 5 years.
Thank you.
Thank you.
Thank you so much, Juan, for your wonderful welcome and really reinforcing the importance of diversity and community and education. Thank you for taking the time to speak to those things. For our first session today, I'd like to welcome Dr. Patricia Moreno, Assistant Professor of Medicine at the Robert H. Lurie Comprehensive Cancer Center of the Northwestern University Feinberg School of Medicine. She will be presenting on quality of life for individuals affected by cancer. Dr. Moreno, whenever you're ready.
Thank you so much, Selena. I am so excited to be with all of you today. Like Selena said, my presentation is going to be talking about quality of life, which is sort of a broad topic, but one that is extremely important to me. I'm a psychologist, and my area of expertise is working with anyone who has been touched by cancer. So patients and survivors, as well as family members and loved ones. And there are some really kind of important principles that I think are helpful to anyone who's dealing not just with cancer, but something that has really kind of rocked your world and changed your day-to-day life. And so my hope today is that we can just have an interactive conversation about some of the things that I think are really crucial and important to being able to cope with cancer and other really difficult adverse experiences in life, and kind of lay some seeds and then hopefully open up for a good kind of Q&A and conversation at the end. But the way that we're going to start off this session today is actually doing a mindfulness exercise. I was asked by ChicagoCHEC to kind of open up the session that way so that we can all kind of get grounded and leave behind all the worries and stress that we carry from moment to moment oftentimes, and that makes it difficult to be where we are. And so if you will with me, I'm going to take us through about maybe a 4-minute mindfulness exercise, and there will be some pauses throughout. And so just know that when there is a pause, we're still in the mindfulness exercise, and I will be very clear about when we finish the mindfulness exercise, so that way you'll know when we're concluding the meditation. All right, so when you are comfortable, if you could just close your eyes or lower your eyelids and find a place to fix your gaze on the ground, and just slowly start to notice your breath. Feel the air moving into your nose, into your body, breathing in and breathing out. Notice your body connected to the floor or the seat. Allow yourself to feel grounded and supported. Allow yourself to bring your full attention to being here in this room, or whatever room you're in, moment by moment. As you breathe in and out, you'll start to notice that your mind begins to wander. Notice your thoughts. Notice any feelings, sensations that come. Notice any sounds around you, and start to observe them. Letting them pass into your awareness, and then gently bring your awareness back to your breath. Breathing in and breathing out. In and out. Continue observing yourself, not judging anything that comes into your mind, simply bringing your attention back to your breath and observing your mind as it might wander away again, but bringing it back time and time again. When you find yourself getting involved in thoughts, feelings, anything that comes up, gently and patiently bring your awareness back to your breath. You may have to do this frequently. With time, you'll find that you move into a place that's calm and watchful and not reactive to these thoughts and feelings. Now I'd like you to try for a moment to focus on one thing you really care about, something you deeply cherish or care about in your life. Maybe it's a person or your work or a cause that's dear to your heart. See if you can really bring it into focus. Picture it with your mind's eye. And now take a moment to notice in your body how you feel when you feel connected to that thing you care about. What thoughts, feelings, and sensations do you have? Try to breathe into those thoughts and feelings. Breathing in and out, in and out. Notice how it feels to be connected to something that is so important to you. Now notice your body connected to your seat. Sense your hands, arms, feet, legs, shoulders, and face. And when you're ready, slowly bring your attention back into the room you're in. Open your eyes and gently move into your body. If you need, you can gently stretch your legs or arms, just sort of settle back into your seat. All right. Great. So normally we would kind of talk about how that felt for everyone, but hopefully you're feeling grounded and sort of present in this moment so that we can talk about quality of life. And Selena, could you just confirm for me, when am I supposed to make sure that I'm done giving my my talk,
Yes.
so that we have enough time for Q&A?
Sure, we have you scheduled until 11:40.
Okay, and the last 10 minutes or so is when we want to do the Q&A within that?
Up to you.
Okay, all right, sounds good. Thanks, Selena.
You're welcome.
Okay, great. So what is quality of life? Let's start off with just getting on the same page about what the term means, because it's something that obviously is referred to oftentimes, but it can be a little bit confusing about what's in the scope of quality of life. So quality of life focuses on different domains of well-being. Physical well-being, which is going to refer to things like symptoms, side effects that you might have from treatment, or that someone that you love is having as a result of treatment. So things like pain, fatigue. It also refers to functional well-being. So functional well-being refers to the ability to do things in day-to-day life. So activities of daily living, like being able to get up, brush your teeth, fix food, being able to do activities that are important to you. So that might be going to work, hobbies, recreational activities, physical activity. It refers to social well-being, which includes all the relationships in your lives and how those are going, whether or not you feel supported by family, friends, colleagues, others around you, and what the impact of any kind of treatment or health condition like cancer has on those relationships. And that also includes relationships with significant others, spouses, partners, and sexual functioning. And then also emotional well-being, which is something that I spend a lot of time thinking about as a psychologist. So this is how your emotional life is being impacted by your life in a health condition like cancer, or the fact that someone that you love is coping with cancer. And so it can include emotional distress, things like worry, anxiety, and sadness. And the important thing to really think about with quality of life is that quality of life is the patient's voice in the experience of cancer or any sort of health condition. It goes beyond any sort of objective or marker of disease. So oftentimes when someone is undergoing cancer treatment or first gets diagnosed with cancer, there's a lot of focus on blood markers or scans, things like that. And those things are incredibly important, of course, to try to guide treatment for cancer. However, quality of life is really what lets us know how a patient is doing, how their loved ones are doing, how a cancer survivor is doing. And it really is the difference between just getting by and making sure that a treatment is working on the body or on the cancer that it's meant to work on, and really that they are able to have a life that is serving them and allowing them to do what is important to them. And so quality of life is hugely important. And we know that it oftentimes was neglected in the past. There was a lot of focus on kind of the biomedical experience and not the psychosocial experience, the emotional experience of what it means to have cancer or how it impacts loved ones. And so now we know a lot more, and there's a lot of research in this area, and it really is individual to each person, right? So if you're thinking about the domains of well-being that I mentioned, you know, physical, functional, social, emotional, different family members, loved ones, and different cancer patients and survivors are going to have different experiences and different impacts, right? And so each person hopefully will receive the support that they need to live as well as possible within the circumstances of having cancer or having a loved one with cancer. However, we know that oftentimes, even when treatment is working, quality of life can be negatively impacted, and that can be incredibly difficult for patients. And so what I want to do in the time that we have today is go over some evidence-based strategies for making sure that you or your loved one are able to address your quality of life, and open up the conversation at the end about specifically how do we think about and deal with emotions and the emotional impact of having cancer. And so the first evidence-based strategy I'm going to talk about, and these are all things when I say evidence-based that we have quite a bit of research to support the fact that they can improve and benefit quality of life. And so we've now started to ask the question of what makes quality of life better in someone who's impacted by cancer. And these are some of the things that have emerged as the most important. And given that we don't have all the time in the world today, I figured I should give you some of these strategies right off the bat, and then we can kind of go into some more conversation about them. So number one that I'm going to talk about is communicating with your care team. And I will preface this by saying that your care team ideally will be asking you about your quality of life, and not just whether or not you have the physical or functional well-being concerns, but also how you're doing emotionally, how you're doing in terms of your relationships and how that has been impacted. However, we know in today's healthcare system, things don't always work the way that they should, especially for those of us who are minority. And I want to emphasize the importance of not waiting and not taking your cue from your healthcare team if they haven't brought up these concerns, but they are a concern to you. You should absolutely let them know if you have something that has changed or that is making it difficult for you to live your life the way you want in your day-to-day. And so don't leave it to them to ask. If you have something that you need to talk about or that you would like more support around, bring it up. If it is not them who will address it, which I think is a concern for many people, is that, well, my oncology focuses on X, Y, and Z, so I don't think I should be telling them about how sad I am, how upset I am, or how my husband is struggling, whatever it might be. Oftentimes, they're a great starting point for getting you connected to the right person if it's not them who's going to directly help you with this issue. And so they oftentimes will have allied healthcare providers, so social workers, psychologists. They oftentimes have access to community resources that they can send you to, something like Gilda's Club. And they oftentimes will maybe bring in a specialist. So if you have pain or fatigue that is kind of been hard to figure out how to treat effectively, then they might bring in someone like a palliative medicine doctor whose whole focus is managing symptoms, right? And so the first thing to do, though, is to communicate and bring your voice into the conversation about your experience of quality of life. I know many patients feel like they want to be the good patient and they want to come in with a brave face, respond well to treatment, and they want to be sort of favorable to their care team so that their care team invests in them. And all of those things are natural sort of experiences that many patients have. And at the same time, it is absolutely crucial that you tell them how you are doing in terms of the domains of quality of life. The second thing I'll talk about is social support. It is really important. In Spanish, we have a saying, know your people. It's really important for you to find out how you can get support from your loved ones, your family members, your friends, your community, to be able to get through this experience. We know that social support is hugely important into how someone is doing in terms of their quality of life. Really important is to match what kind of support you need to a specific person. And what I mean by that is that you're gonna have potentially someone in your life, like a sister, who's incredibly good at listening to you when you are upset and able to hold space for your sadness, able to sit with you in that, get you through, say the right things, and let you have a moment when you need to have a moment. So that's a person that you should know that when you're in a place where you need that kind of emotional support, you go to that person. At the other end, there might be someone who's all about organizing, planning, having a calendar. That person might not be the most well suited for having a moment of emotional support, but they may be incredibly good at helping you figure out your treatment schedule, or helping you get to and from the hospital when you need a ride, or helping you figure out specific things with the fine print of your insurance plan. And what I'm trying to get at is that oftentimes social support can be hard when you have a mismatch between the family member or friend or colleague that you're going to and what they can offer you. And so try to be really thoughtful, and this is for both, you know, family members, caregivers of someone living with cancer, as well as someone who's been impacted by cancer directly. Really know your people and know what it is that you need, and then make sure that you try to go to your loved ones who can give you the support that you're looking for. Try to be as honest as possible about your experience. Oftentimes, some of my research has shown that when you have, for example, a couple where one of the two members of the couple has been diagnosed with cancer, there's a lot of trying to protect the other person about how they're doing and what's going on for them. And so they don't open up fully about their experience, and then they miss opportunities to be really honest, support each other, and come together around how difficult this experience really is. So really try to prioritize getting connected, try to get creative during COVID, you know, a lot of FaceTiming, video calls if possible. I know that this is not the easiest time to stay connected, but there are ways to do it if we think about it and we prioritize it. And I'll also say that many individuals who have been diagnosed with cancer will say that there's nothing like getting support from someone else who has had cancer in a support group or a community forum. And same thing for spouses, partners, caregivers of someone living with cancer. There's something really unique to being able to speak to someone who has had that experience. That's different than what you can get from your family, friends, or loved ones. No one will ever replace your family, friends, or loved ones, but there's something really unique about being able to kind of see each other and know the experience. And so I oftentimes think that's an important acknowledgement. I'm not going to talk much about healthy lifestyle, nutrition, physical activity, because I know you have a presentation on it after this, but I will just say it affects more than just physical and functional well-being. It is really important for emotional and social well-being. And so, you know, you can be gentle with it. You'll have modified physical activity plans, things like that, but it is incredibly important for feeling also empowered. I think oftentimes what we don't talk about enough with cancer is that you can feel like so much is uncertain, so much is out of your control, whether you love someone with cancer or whether you are someone who's been diagnosed with cancer. And being able to do something like, you know, focus on your nutrition, focus on your physical activity within your ability, within what is right for you and what is healthy for you, can really make you feel empowered in a time where it feels like control is out of your hands oftentimes. And so I think that that is something that I always like to underline, but also set the expectation that we're not talking about running marathons or anything. We're talking about gentle walks. We're talking about chair yoga. We're talking about very appropriate and modified approaches to these sort of lifestyle factors. And then we will talk about stress reduction. This is hugely important, and there are many ways that you can reduce stress. And this is where, if you feel stuck, it may be really helpful to talk to a social worker, a psychologist, a counselor, or go to a support group. But as a rule of thumb, you know, things that can be incredibly helpful are making time for activities that you enjoy and doing them really intentionally. So making time for them. And I know that sometimes supporting someone with a cancer diagnosis or being diagnosed with cancer is a full-time job in terms of how much time you spend in the hospital, how much time you are planning your appointments on the phone with providers, with health insurance companies, etc. So it can be very small things like making a 5-minute ritual in the morning to have a cup of tea and just, you know, do some breathing exercises. I'm not talking about completely restructuring your life. I'm just talking about taking small moments of time in each day to engage in the little pleasures of life. Making sure to ask for help from your social support is incredibly important, your social support system. Doing relaxation, like what we started off this session with, is very important. That really changes your biology in terms of anything that can be activated by stress in your body. So you'll feel the difference if you start to manage your stress by using those relaxation techniques. You'll feel less muscle tension, lower blood pressure, lower heart rate. You'll see that your stress hormones will change over time. And so I can't emphasize enough about managing stress or trying to reduce stress as much as possible. I don't want to make it sound like I'm setting unrealistic expectations. The reason I say it's important to manage and reduce stress is because I know how incredibly difficult and stressful cancer can be for anyone affected. I've been working with cancer patients and their loved ones for 7 years across 3 different cancer centers, UCLA, Duke University, and Northwestern University. And I know how deeply difficult it is. And so again, if you're feeling stuck, reach out, and there will be resources for you so that you can kind of try to make a plan together with someone. And then the last thing I want to talk about, although I am running very low on time, so I'm gonna say this pretty quickly because I do think it's so important, is your emotions. What do we do with your emotions? Oftentimes we hear language like fighting cancer, your battle with cancer. I want to emphasize, I know that that can be empowering and that that can be important for many people, but I also want you to know that no one wants to be defeated by cancer. Everyone is trying their hardest, and that doesn't mean that if someone doesn't respond well to a treatment or some hiccup comes up or roadblock comes up that they have failed. Bravery in this experience is not staying positive all the time, thinking positively all the time, only having hope. Those things are very helpful for many people, and they can be incredibly important to getting through, but they can become problematic when they become the only way that someone can respond, that the only expectation is that you have to be positive all of the time or feel like this warrior all of the time. And this is for patient survivors as well as their loved ones. It doesn't normalize that the experience of having cancer is incredibly difficult, and that comes along with lots of emotions, not just happy or pleasant emotions, but sadness, anger sometimes, guilt. There are many things that come up. And if you are someone who is supporting someone with cancer, it's important that you know that if you really double down on the think positive, have hope language, it can signal to someone that they shouldn't share the other experiences or emotions that they have. And I really want to emphasize that it is healthy and expected to have a whole range of emotions in response to having cancer. Many emotions, not just the pleasant or grateful emotions, but also the sadness, the worry, the anger, the frustration, the guilt, that these are expected, and they're what makes us human when we're responding to something like cancer. And it doesn't mean that someone is not grateful for things that have gone well, or that they think they have it the worst out of everyone. I've had so many cancer survivors and patients tell me, well, I didn't have chemo, so I feel like I should just be thankful. You know, empathy is not a resource that runs out. You can both be gentle and kind to yourself, as well as have empathy for anyone else who's been impacted by cancer. And this goes for loved ones as well. And so I want to really kind of debunk that myth about staying positive and having hope all the time, and not making room for all of the human responses that we have to something as difficult and devastating as cancer. So what can I do right now with my emotions? Cancer does give us clarity about what's important in life. No one would choose cancer, but what it does do is peel away a lot of those layers and let us know this is what is important to me, this is what's my priority, and focusing on what is important to you, those relationships, that desire to learn, be creative, take part in your community, develop yourself and your interests. All those kinds of things are what makes life meaningful and makes us feel like there's purpose to our life. And having meaning and purpose in our life will get you through even the most difficult moments of your life, and it will not take away the pain. It will not take away the sadness and anxiety that you can experience, because like I said, those are all really normal human responses to cancer, but it will help you feel like you have a life worth living because it's grounded in what's important to you. So I know that was a bit of a whirlwind, but those are the things that I think are most important that I would want someone who has been impacted by cancer or any really difficult life experience to know. I know I'm running a little low on time, but I would love to be able to take questions. If not, maybe we could find another way to make sure that I have an opportunity to give back to the conversation in some way. You let me know, Selena.
We do have a question in the Q&A, actually. I can read it to you unless you can see it.
Do you want to read it to me? Just so
Sure.
I don't know if
Okay.
I should put the chat, so yeah.
No problem. It is from Jeanette Gonzalez. She says, I work with Latina cancer survivors, and the biggest challenge I face when trying to connect uninsured, undocumented women to psychosocial services such as therapy, there are very few resources to refer them to. Do you have a resource list you can direct us to for this population?
So thank you. That's a great question, and I think that really underlines the importance of structural and systemic barriers to care. And so the first thing that I would say would be community resources like Gilda's Club or the Cancer Wellness Community are I would say are the most powerful resources for someone who is uninsured or just has underinsured coverage where they have insurance for healthcare, but not necessarily behavioral care within that. I don't have a list, but I can try to dig up some information and pass it on to ChicagoCHEC so that they can pass it on to you, Jeanette. But yeah, I would say certainly Gilda's Club and Community Wellness Center are the most important, and they have multiple sites all around Chicagoland, which I think is really, really important.
They are very wonderful. I have worked with them a bit.
Absolutely, yeah.
Thank you so much, Dr. Moreno. All of this information is so helpful. And for starting us off with a mindfulness exercise, I know taking those few moments can be really powerful and really healing. If you want, before you go, if you have any online resources for those things that you could drop in the chat, I think people would be willing to go ahead and review them.
Absolutely.
Okay, thank you. So before we continue this conversation, I just want to remind everyone that we do have another raffle again today, and those updated links have already been posted in the chat, so feel free to confirm your attendance in order to enter. Now,
we have a hand raised by Dolores. Maybe she has a quick question for Dr. Moreno. No.
Okay.
Hi, Dr. Moreno and Dolores. Thank you for the presentation. My question is, I in Little Village, in my community, I see a lot of survivors from cancer, but they lose they lost in the system. They don't know what to do. They don't know how to get the support, especially for the family, because the family very busy working 2 jobs, and sometimes they don't have the time to even to console or be with the patient. And the other thing happened, the family do everything for the patient, asking the patient, it's okay with you to do this for you. And then sometimes we try to do everything because we don't have that time and just design for the patient. And I see the afraid for the survivor for cancer, especially people who's not documented in this country. They feel like I can do that because I'm gonna have trouble with immigration, things like that. How in one way we can put awareness about doesn't matter in what is your studies in this country, we have this kind of support or resource, because I know it's a limited resource, but what can we do with that?
Thank you for your question, Dolores. Yeah, the dynamics between family members when the family is coping with something like cancer, it can be incredibly complicated in terms of, sometimes a patient or cancer survivor wants, one thing, and the family has different opinions, and there is a lot to sort of manage there. I would say that I think the healthcare system here is the challenge, but can also be the vehicle. And what I mean by that is that very few patients, especially in our communities, know how to get support beyond having their kind of oncologist or cancer care provider. And so while other kind of groups of patients might be really savvy about going out and finding support resources, psychologists, et cetera, I think that the most important thing that someone can do is ask their oncologist, who can I talk to about getting connected to resources? And like I said, that oncologist, him or herself, may not be the person who's going to provide that kind of support for the psychosocial needs, but I can almost guarantee that they will have someone, whether it's a nurse, a social worker, an administrative person, someone in their office will have some list of resources or some way of helping point you in the right direction. And then from there, I think you have to kind of be mindful about, do they offer English and Spanish language help, things like that. And so, but always start with the care provider, because you already have a relationship with them. They know who you are, and even if it's not them, they will be able to point you to some resource, either within their own practice or their own hospital, medical center, or outside. And beyond that, I would say, again, if you want to do some searching on your own, you can look at some of these community resources that I mentioned that do have English and Spanish language resources like Gilda's Club and the Cancer Community Wellness. So I hope that's helpful. I know it can be extremely challenging when you have, in like low insurance coverage as well as no insurance coverage. And when you add into that any sort of consideration about immigration in today's socio-political context, it can just be really difficult and really scary oftentimes to try to reach out for support. And so, I think starting off by getting information and then from there making informed decisions about what's right for you and your family is really important. But don't give up on the idea that there are individuals out there who are really dedicated to helping our community. And sometimes it can be hard to find them, but they are there. And if you need that support, I would say try to stay brave and ask the questions, and then you can make decisions that are right for you and your family.
Thank you very much.
You're welcome. Thank you.
Thank you, Dr. Moreno. We've also actually posted some links in our chat box that of different organizations that also provide support for Spanish speakers for those who are interested. Okay. Now, with that, I would like to welcome our next two speakers. They will help continue this conversation. We have Angela Dennison, an oncology dietitian, and Jaden Chipman, an oncology exercise specialist from Wellness House. This session is all about healthy lifestyle, nutrition, and physical activity for those impacted by cancer. Angela and Jaden, please take it away.
Thank you so much. Oh, sorry, I'm trying to get my video on. But Angela, I guess if you want to start, I'll mute myself.
No, please go ahead. Go ahead, Jaden.
Can everyone hear me okay?
Yes,
we can hear you.
Okay, sorry about that. So my name is Jaden Chipman. I'm an oncology exercise specialist with Wellness House, here to talk about the importance of exercise and some of the additional stresses that we can experience during the COVID-19 pandemic. And thinking about, the March 16th, 2020 sticks out as the day that all of our lives are really turned upside down by COVID-19. And during this unprecedented time, I think most of us have experienced a heightened awareness of our health, including, physical activity, nutrition habits, and self-care. So I'm here today to share with you the importance and benefits of physical activity in the throes of a cancer diagnosis and tips for staying active safely in the course of this pandemic. There are so many benefits of exercise, and now with COVID-19 and everyone staying home, it is more important than ever to move your body. Whether you have been diagnosed or are caring for a loved one with cancer, exercise and movement is paramount to feeling energized and to be able to take on the rest of your day, especially in these heightened moments of stress. Although exercise won't prevent you from contracting the virus, our research shows that exercise improves our ability to fight off infection, like the cold and flu, by stimulating our immune system response and improving its fight against illness. The list of benefits is a long one, and I feel like I could talk for hours about the research and benefits of physical activity for the cancer patient, but I will spare you. However, I do want to highlight some of the evidence-based and really well-researched benefits of exercise for cancer patients. So 80 to 90% of cancer patients experience what we call cancer-related fatigue at some point in their cancer journey. And this might resonate with some of you here in this room. Cancer-related fatigue isn't feeling tired. It's so much more than that. It's the debilitating fatigue that can force a person who's doing something throughout their day to have to stop and take a break. But what's promising is that research shows that even small amounts of physical activity can have a lasting impact on cancer-related fatigue. And patients often report less severe bouts of fatigue and fewer fatigue episodes. And we also see substantial evidence which suggests a correlation between physical activity, especially aerobic exercise, and a reduction in depressive symptoms, feelings of anxiety, and decreased mood, which all have been amplified by COVID. The good news is there are things that you can do to stay active during the pandemic. And for some, the pandemic has been a catalyst to healthy lifestyle choices and has served as motivation to be as healthy as possible. But if you're like me and part of the majority and haven't felt motivated to get up and move, you're not alone, and we are all in this together. And Wellness House, the nonprofit organization, makes it easy to stay active in your home. All you need to do is sign up for a program on a computer or a phone, and we take care of the rest. And I will be talking a little bit more in depth about these specific programs that we offer at Wellness House here in a few minutes. But I do want to highlight the American Cancer Society recommendations as far as the amount and intensity of exercise you want to achieve if you've been diagnosed with cancer. So if we look at the high-level overview here, they recommend 150 minutes of moderate aerobic exercise, 2 to 3 days of resistance training, and 5 to 7 days per week of stretching, 2 to 4 reps per stretch for 20 to 30 seconds. Please note that I do not advise that you go from no activity to achieving the physical activity guidelines, especially if that's where you're at right now. It is a very slow, progressive process with bumps along the way, but that is where Wellness House comes in. I'd like to talk about some ways that you can stay active at home during the pandemic, in addition to some Wellness House resources that we offer. So I am going to highlight some of the tips that I shared here with the resource that I provided to Melissa, titled Tips for Staying Active During COVID. First and foremost, trying not to be too hard on yourself. I think we are all trying our best to really get through these difficult times. And even small changes can have a lasting impact on your health. And something is always better than nothing. So just focusing on where you are right now, being okay with that, coming to terms with where you are, and then making some small changes. Getting outside if you can, but check the latest guidelines on the specifics of your area. Of course, avoiding contact with other people, but just opening the windows and getting some fresh air can really improve your mood, which can lead to healthier choices later in the day. So if our mood is improved, we might be more likely to choose that healthier food option. We might be more likely to get up out of our chairs more often through the day because we are already feeling the effects of the improved mood. You can also make it a social activity, including the people that you are quarantined with. Of course, I'm not going to suggest that you get involved, with large groups of people. But talking to the people that you live with about your goals. Social support is so important, and that was mentioned earlier. not only for exercise adherence, but also for just giving you the encouragement and positive affirmations to continue kind of doing those healthy activities such as physical activity. And if you live alone, calling someone who you can trust to check in with you and offer encouragement is really recommended and encouraged. Wellness House can also be that support system. It isn't uncommon for participants in the exercise program to give me a call if they're having some issues, continuing with their program, or they need some additional insight for how they can make their specific exercise routine more unique to their needs. Also, designating a space in your home to kind of be your active space is really helpful. It doesn't have to be a separate space. It can absolutely be an extension of your living room or dining room area or a small space in your bedroom. But you do want to make sure that there aren't a ton of objects around you that would pose a risk of harm, but you don't need a ton of space. If we think about the amount of space that we need to stand up and sit down, right, to just stretch our arms out to the sides, that's really the only, the amount of space that you need. But things like setting up your yoga mat if you're going to use a mat or any equipment that you're going to use, setting out your clothes that you're going to wear, getting your water bottle situated kind of in that space the night before can be really helpful. I think in today's world, even making the smallest of decisions can be very overwhelming. So if we can make those decisions before we have to decide that we are going to be active, that can really help set you up for success. Tracking your activity is really important, so you can use the SMART Goals worksheet that I provided and place your worksheet in a place where you can easily see it. Also, keeping an exercise journal can be quite helpful as well if you prefer to have a booklet. Things that I recommend documenting is how you're feeling that day, talking about your fatigue on a scale of mild to severe, how you felt in the middle of the day, how you felt later in the day, how you felt after the activity, what were some challenges or barriers that you faced. And if you didn't do any activity that day, being kind to yourself, giving yourself grace, that's okay. It's not easy for all of us to do all of the things that we know that we could or should be doing for our health. Sneaking movement into your routine using things like chores. Now that we are home, a lot of us might be doing some more household projects and we're just staying home more often. So if you use house tasks like scrubbing or sweeping, dusting, things like vacuuming, it all adds up and we end up with a clean house, and then we're also working our arm and leg muscles. So that's all really great. Exercising during commercial breaks, I think, can be very valuable. So we also might find ourselves watching more shows or sitting on the couch during our free time. So if you are doing something like that because you enjoy it, making those breaks in commercials or credits count by standing up instead of sitting, squatting, doing things like wall push-ups or simple stretches, or even just breathing. That can be very powerful as well. Just taking those moments to do something simple that can be really good for your body. Moving around the house more, this kind of goes along with sneaking movement into your routine. So walking around while you're talking to someone on the phone, for example, if you are able, that's something that we don't even think about that we do while we're sitting. So that we can easily change that to something that we can do while we're standing. Taking an extra lap or two around the house if you need to put something away, for example. I think sometimes we always try to find shortcuts, like I don't want to get up as often, so maybe I won't walk as far as I need to, or I'll take this load of laundry down when and then take the next load of laundry down. But just finding moments where you can incorporate small activities into the things that you're already doing. So taking that extra step to go up the stairs an additional time. If you aren't safe taking the stairs, there are other things that you can do. If you do feel safe going up the stairs, going a few stairs at once, taking a break, going up a few more stairs and taking a break, that is very encouraged for your safety. Following your body's rhythms, so planning your activity during moments where you're feeling your best and have the most energy. And it's common if you aren't feeling much energy at all right now. And if that's the case, there isn't a time of the day where you're feeling most energized. Just trying to find a time during the day where you can incorporate 2 to 3 to 4, or even 5 minutes of activity. Rewarding yourself often. So our current situation makes it really difficult to partake in our favorite forms of exercise. It can be frustrating. Oh, hang on, sorry. Or you might find that you can't reward yourself in the same ways that you could before. But don't beat yourself up. Instead, try and focus on how much better you will feel after moving just a little. And then finding simple and new ways to reward yourself that are safe kind of during these COVID times. So if you like to go hang out with your friends in a big group, instead of doing that, how can we do that on Zoom? There are different ways that we can stay connected via Zoom that are much more safe than gathering in large groups. I do want to note that you always want to delay exercise if you are feeling unwell, and follow up with your healthcare provider, as well as your exercise specialist if you are working with one. Just because we can't see you in person, so it's really important that you are open and have those conversations with us about how you are feeling. That way we can make sure that the program that we are providing you with and the recommendations are safe for you. And with that, I do want to talk briefly about our wellness house programs, our exercise programs. So all of our exercise programs and stress management programs have gone virtual in the light of COVID-19. We have classes like chair yoga, mat yoga, stretching, body weight exercise, resistance training, Pilates, and Tai Chi, very gentle exercise. We know that people in treatment, of course, it's important for them to keep the intensity more moderate. We have something for everybody. We also recognize that caregivers have a unique role and need as much support as the survivors. So many of our classes are open to the diagnosed as well as the caregiver, and they're often encouraged to participate together because we know that experience is very valuable, participating in something like that together for both the caregiver as well as the survivor. And I just want to be aware of our time, so I think I'm going to hand it over to Angela before we take questions, who will be talking about addressing cancer through COVID as it pertains to nutrition.
Hi, everyone. Excited to be here with you all today. And my name is Angela. I am the registered dietitian at Wellness House. And I'm excited to talk about nutrition today because it is a very important piece of this entire puzzle, right? So when we're looking at living with cancer, whether you're in active treatment, whether you're done with treatment, nutrition makes such a big and important impact. And it's actually one of these areas that we have a lot of opportunity to kind of wedge into. It can be a really easy way to kind of approach and take this kind of control back with your health. And so when it comes to nutrition and cancer, there are some very specific recommendations, and we'll get into that. But what I want to start off by saying is that I know each and every one of you are different and unique. And so some recommendations may be a little bit different, and especially assessing if you have side effects from treatment or any side effects lasting from treatment, not tolerating foods very well, recommendations can definitely differ. And know that, I do work at Wellness House. All of our services are free. So know that you can connect with me to kind of talk about these things if you need more individualized support. But, with starting with nutrition, it's a way to kind of just feel really empowered. And I'm sure you've all have heard the term plant-based eating before. You know, the term plant-based gets thrown around quite often now. But I want to talk about what that means, because when it comes to cancer and nutrition recommendations, it is recommended that you follow a plant-based diet. But what does that mean exactly? Because that term can be a little bit confusing, and it can feel like something that's not approachable at times. And so basically what it means is you are eating more fruits and vegetables and whole grains and nuts and beans, more than you are like meat and dairy and animal products, right? So we kind of are looking at the overall balance in which you are eating these items. And so why are plant-based foods so important? You know, all of our vegetables and fruits and all of those foods that I had just mentioned, there's a reason why they're so heavily recommended. And so they're filled with fiber. You're only going to find fiber in your plant foods. And we know that high fiber diets are really good for us and protective against a lot of different chronic disease, and cancer being one of them. And, you know, ideally, oh, so we have my little hand up here on the screen here. So yes, they're filled with fiber, a wide variety of vitamins and minerals, and something called phytochemicals, also known as phytonutrients. It's interchangeable. And so phyto means plant. There are these chemicals found just in your plant foods. And these are what make plants so special. So our phytochemicals are heavily tied to the color of our foods. So if you ever have heard the term eat the color of the rainbow, that is why, because every different colored food you're eating is going to kind of give you a variety of different nutrients. But these phytochemicals help keep a strong immune system. They help combat inflammation, specifically the kind that can make cancer growth more likely. They protect our DNA. There's so much that these phytochemicals do. And again, you're only going to get these through your plant foods. And so when you're thinking about where you are now with your food, what your goals are, you know, just like Jaden had talked about exercise, little steps and little tweaks absolutely go a very long way. So no matter where you are right now, know that improvements can be made at your very next meal, right? And so this is kind of on our website, they do have, and you'll find the links to our resources in the chat box. So you will have some additional links, as well as a larger version of this healthy eating plate that I have here on my document. But definitely look at that when you're thinking about constructing your meals, right? So kind of looking at how you're eating now versus kind of what the recommendations are. And so if you are eating animal protein, and that's okay, and you know, we're just going to be talking about the recommendation of what that looks like. And so making half your plate fruits and veggies is a goal. If you're eating grains, going kind of more of a whole grain route. So for example, if you enjoy rice, can you have brown rice more often, you know, wild rice, things like that. Exploring different kinds of grains like quinoa and millet, you know, there's all different kinds of things that we can explore in order to get that variety into our diet. And so with some recommendations, you know, when we, you know, typically, if we're meat eaters, it is very common for us to kind of center that meat on our plate and add in maybe some vegetables and, you know, here and there. But what we want to do is kind of we want to make that the opposite. And so we want our plants to be the star of the dish and meat more of like the side and the condiment and kind of on top. So, you know, kind of start thinking about how you can start to make those small switches. And when it comes to meat consumption, there are some specific recommendations. Now, red meat is no longer just beef. It's also pork and lamb and goat. That all falls under the red meat category. Pork is typically a surprise because we like to think of pork as the other white meat, but it is in fact the other red meat. So for cancer protection and prevention, the recommendation is a range of no more than 12 to 18 ounces in a week. Okay, so again, that's 12 to 18 ounces in a week span. That is what is recommended. Now, when we're looking at your processed meats, so processed meats are anything that has been like salted, smoked, cured. So that would be your bacons, sausages, hot dogs, deli meats, right? All of those things are considered processed meats. And we do know that eating these they increase our risk of cancer overall, mainly more GI cancers. But for the general population, it is recommended that we avoid these items as much as we can. And yes, that does include turkey sausage and turkey bacon. I get that question very, very often. And so, you know, when it comes to other very specific recommendations, what I'd like to address is, because everyone is all in kind of different, we're all in different spots, right? We all have our own habits, and there's so many things that play into the way we eat, right? If we only ate to fuel ourselves, we would be extremely healthy. But, you know, there's a lot of things that play into our habits with food, you know, our culture, the way we grew up, and, you know, there's emotional ties to food. So there's so many things to think about, and changing our eating habits is not always as easy as we think it you know, it can be a little bit more challenging for these reasons. But kind of these small steps of, no matter what you're eating, can you add some veggies to it? Can you snack on fruit? Maybe instead of, if you happen to go for more like cookies and candy and things like that, you know, fruit is a really nice sweet substitute. So kind of identifying these little areas of opportunity are really good ways to start. So as you can see here, we have the healthy eating plate just at the forefront. And so this is an ideal healthy eating plate. This does not have to happen overnight. I don't expect this to happen overnight. You can kind of take baby steps to make this happen. And one thing I want to stress is water should absolutely be your main beverage. Staying properly hydrated is not only important for your overall health, but also your energy levels. And if you are currently in active treatment, the better nourished you are, the better hydrated you are, makes your body stronger as you're going through treatment, and you can be less prone to a lot of the side effects that you may be experiencing. So I'm being conscious of the time here. So I want to just mention a few other things. So as we have this focus on, you know, COVID-19 and what we're doing now, as far as in the midst of navigating this world and still trying to focus on our health, you know, one plus maybe I can say, or good thing, is maybe you're cooking more at home, right? Maybe you're in the kitchen a little bit more, which I think is a great thing. If you are a little, you know, not that confident on your kitchen skills or cooking skills, I always like to say it's like picking up a guitar. I couldn't go pick up a guitar because I don't know how to play, but if I practice, I could get good. And that goes along with cooking. If you're not familiar with cooking and how to navigate that, it's just something that if you start doing, you will start to build those skills, I guarantee you. So COVID-19 may have presented that opportunity for you to get back into the kitchen and start cooking more at home. And that's wonderful. You know, and there is no evidence to show that COVID-19 is a foodborne illness, right? But I always am encouraging you to wash your fruits and vegetables really well. And an easy way to do that is under cold running water with some friction. You can use your hands for that friction, or like a vegetable scrub brush, but that will clean your produce. So even though you may be cutting into something like, say, an avocado, we don't eat the peel of an avocado, but you still want to wash that item to make sure that any potential bacteria isn't piercing the actual portion that we're going to be eating, right? So when we're thinking of staying healthy within this time, plants, they're going to boost your immune system. So again, think about how can we improve our intake with these vegetables and fruits and whole grains and our healthy proteins in order to boost that fiber, boost those phytonutrients. Again, wash all of your produce when you before you consume them. And you know, if you're shopping less, stock up on items that last a long time. You know, if you've ever had an opportunity to, you know, if you're loading up on all of this fresh stuff and you don't get to it as quick as you want and it happens to go bad on you, I know we've all been there. Think about things that last a little bit longer, but that are still really nourishing. So don't be afraid to stock up on frozen fruit, frozen vegetables, frozen grains. They last a long time and they are just as nutritious, sometimes more than the fresh counterparts. Think about like onions and carrots and beets, garlic. Our winter squashes are coming into season. Those are really hardy. They last a long time, so they can assure that you have things in the house in order to kind of build a healthy plate if needed. So again, when it comes to, and there is so much to talk about with nutrition, and today we are just really skimming that surface. But please know, when it comes to nutrition, it really can make such a powerful impact on your overall health moving forward. You could start at your next meal. You could start tomorrow, just by making some of these really small tweaks. And not only are we doing a body good when we're focusing on nutrition, but there is some research to show that even just cooking has a really wonderful impact on our mental health. Especially, it could be an opportunity to cook with your family members, right? Kind of building that sense of community when we have such a hard time reaching out to our extended communities right now. And if you are, I want to kind of just present some of our programs, nutrition programs that we have at Wellness House, in case you are interested in plugging in. We have, again, everything at Wellness House it's free. It's at no cost to you. Everything from support and networking groups to exercise to stress management and our nutrition programs. We do cooking classes. So we do cooking classes that you can sit and watch our facilitators, or you can actually participate from the comfort of your own kitchen. So if you're looking to build your skills overall, know that that's an option. And so please check out our website, wellnesshouse.org, for just, more information on our programs, or if you would like to attend any of these. Reach out to me if you need help assessing your own intake. If you want to grow and learn new skills, please come to Wellness House and do that with us. And thank you so much for allowing me this opportunity to, again, talk about nutrition and cancer. And I hope I have the opportunity to work with you guys.
Thank you so much for all of those great tips on just how to find creative ways for incorporating exercise into our daily lives, and also reinforcing that with both diet and exercise, we can slowly start making small changes to the way we eat and work out, so that it doesn't feel too overwhelming all at once. Is it possible to put I think someone from ChicagoCHEC can possibly put the website for Wellness House into our chat box for those interested in checking out those resources, yes?
Yes, we'll go ahead and do that.
Perfect. Thank you. Okay. Now, before moving on to our last session, quick reminder, we do have a lot of great things going on in our chat box right now. There's all those links for external resources, and again, that attendance form in order to get some more entries into our raffle, which will be announced after the end of this next session. So with that, I would like to welcome Dr. Susan Hong, Associate Professor of Medicine and Director of Cancer Survivorship at the University of Illinois Cancer Center. She will share her experience with telehealth during this pandemic. Dr. Susan, whenever you're ready.
Good afternoon, everyone. Thank you for letting me talk today. I have a PowerPoint presentation that I wanted to share. Is the screen share feature up?
Yes, Dr. Hong, you can share your screen.
Okay, great. So today, I wanted this to be more of a didactic, exchange of experiences and information, but I have a little bit of a short PowerPoint presentation to go through. Can everyone see my screen?
Do you want us to share? Do you want me to put up your slides, or do you want to share it yourself?
Am I sharing it? I don't know. What are people seeing?
Right now, oh, hold on.
Are they seeing my telehealth and cancer care during COVID?
Could someone tell me what they're seeing right now?
Yes.
Yeah, I'm seeing it.
Okay, good. I just wanted to make sure. So, I mean, I can go through the slides. You guys don't have to do that as long as people are seeing it.
Dr. Hong, we're actually not able to see your screen. Right now, we're seeing Beverly's screen, but she does have your
slide. So Beverly, do you have the slides?
I do have the slides.
Okay. So let me actually, I may have to send you a more updated slide. So let me just send you what I have right now, okay?
Okay. But if you want, you can click on share screen and share it on your own if you want.
I thought that's what I was doing, and I guess it wasn't working.
So the green button for me, it says share screen at the bottom. Do you see it?
No, yeah, I've been using this before, so that's why. Let's see. So now
Perfect.
Can you see it? Okay, perfect.
Yes.
Okay, perfect. All right, so I'm going to talk about telehealth and cancer care during COVID, and it's more of a here are some of the things that have happened, and what are some of the potential issues that we're going to be facing. All right, maybe. So as many of you are probably have seen this is from the Johns Hopkins COVID dashboard. And this was as of yesterday, close to 30 million global cases of COVID with about 950,000 deaths worldwide. And just to look at what's happening in the United States, Cook County is about the 4th highest in terms of COVID rates of infection and 4th highest in terms of deaths. So we still obviously have a pandemic that doesn't look like it's dying down anytime soon. And as a result of this, in March, on March 20th, Governor Pritzker had announced a stay-at-home order, which, as you know, we've been sort of phasing out of. And most states, not all, but most states have had issued similar orders, and the states are at various stages of opening, closing, opening, and reclosing. So what this has done, this has actually changed pretty much every aspect of our lives, including healthcare delivery. And so I want to talk about telehealth and telemedicine. There's a little bit of a difference. And so the definition of telehealth is the use of electronic information and telecommunications to support not just healthcare, but education, public health administration. And the technologies can be in the form of video conferencing, it can be media streaming, it can be wireless communication, or terrestrial old landline communication, okay? Telemedicine is really for the purpose of Medicare and Medicaid, speaks specifically about improving patients' health by permitting two-way, real-time, interactive communication between the patients and the physician or practitioner. It's been around for more than a decade and requires the use of audio and or video equipment. And even though it's been around for more than a decade, I think we all quickly became very, very familiar with it in a very short time period. They have done studies about the effectiveness of telemedicine delivery, and it is cost effective for how it had been used. Whether it's cost effective for every aspect of healthcare is unknown. And so this is something that you may have personally experienced. Certainly this is something that we're all very familiar with, but this is a patient receiving telemedicine services with a nurse on the other line, kind of reviewing prescription medication usage. Telemedicine has a lot of great and practical implications. So you can actually deliver healthcare remotely to people who live pretty far away. So it's been used very effectively for people who live in rural areas. We can use it to deliver things like genetic counseling. We can have basically telepathology, which is you have a consultant pathologist review path slides at a small community hospital and give their professional opinion. You can actually use it to branch out of some specialized types of services like palliative care and perhaps even survivorship care that may not be available in all institutions. And so there's a lot of great things about telemedicine that we have just started to understand. what I want to do is sort of highlight a big initiative that we're about to start. And we had planned to roll out the Family History Screening Initiative through Miles Square using a tablet-based in-clinic platform, but because of COVID, we're actually going to do this virtually. Patients can call this number, and you're all welcome to call this number, and you'll get a person on the other end, a recorded voice that tells you to push 1 if you want to receive the family history screening link in English, push 2 if you want it in Spanish, and it will be delivered directly to your telephone, and you can fill out your family history questionnaire. And based on that information, we can determine who is eligible for genetic counseling and testing, and then we can reach out and talk to patients. This is something that we're planning to implement, and we're doing it through a telemedicine platform because of COVID. You may have already started having telemedicine visits with your primary care physician or specialist, and now that UIC has Epic, you can actually, in somebody's chart, directly click on the video link and get into a picture that looks like this, where your doctor is on one screen and you're on the other screen. And so instead of actually you coming to clinic, we can actually have a virtual visit. But the problem is, as you all are probably pretty well aware of, is that this is not the perfect solution. We have in this country a huge digital divide. We certainly see it in Chicago, where not everybody has access to reliable internet services. Not everybody has access to technology that you need to have, and you actually need to be able to know how to use the technology, and it can be very challenging. The other limitations, and so you know, they talk about a lot of telemedicine clinics popping up, where instead of waiting for a primary care physical, you can actually just schedule a virtual consult with a doctor. But that requires you having computer technology, internet access, and the ability to navigate the internet and find somebody that you're willing to see. And then even though technology is advancing and we have some home monitoring equipments available, it's not the same thing as seeing a patient in clinic. This is something called ECHO, EKO, and it basically is used in the heart failure world, where patients with chronic heart conditions can put up this monitor to their chest, and the doctor on the other end can listen to their heart sounds. And so, you know, it's a way of virtually and in real time connecting with the patient. But you know, it's not the same as this. You know, I can't pop out of a screen and do a physical if you tell me part of your body hurts, or your lungs, you're coughing, or you don't feel as good. And so it's not a perfect be all or end all solution. And so as a result of this, what's been the impact, especially in the cancer care world? Well, we know that there have been delays in cancer diagnosis. We know that there have been delays in cancer treatment because of COVID. A lot of elective surgeries were completely suspended for a period of time, so people were not getting surgeries, much needed cancer surgeries. People are behind in their surveillance tests. And so instead of getting your 1-year follow-up or 6-month follow-up imaging, people are many, many months behind. We've actually suspended, we're starting up at UIC and other places to have in-person support services, but a lot of the physical therapy, occupational therapy, that was not accessible for a time period. COVID had a huge impact on clinical trials. And then there's also this huge economic impact. A lot of patients lost their jobs because of the economic crisis. As a result of losing their jobs, they lost their health insurance. And so places like Miles Square are seeing a lot more patients because they no longer have the private healthcare coverage that they used to have. And so we know that this COVID is having a huge impact, and telemedicine and telehealth is not able to bridge the gaps that we're seeing. There was a recent paper out of the UK looking at what the lockdown has done in terms of cancer mortality. And this was published in Lancet Oncology. And they're predicting over a 5-year period, almost a 10% increase in breast cancer deaths, 15 to 16% increase in colon cancer deaths, 5% increase in lung cancer deaths, and a 6% increase in esophageal cancer deaths. And this, remember, this is a country with national health care. And so how COVID is going to impact the cancer mortality rates in the US is not known, but the concern is that there is going to be a significant impact, especially on the most vulnerable populations. And so, I think that time will tell, and certainly we're doing our best to try to get people into their screening tests, getting their follow-up and surveillance, but I think that we still have a long way to go. And so, this is yet anytime there is a strain on the existing system, the most vulnerable patients experience the greatest, have the greatest negative impact. So what can we do? I think that trying to democratize technology is really one very, very important thing. I wish that Illinois, for instance, I have a daughter who's in school and she's on inline school. I'm paying for a private school, but a lot of states I found out actually have K-12 as part of their public school system. And so and Illinois unfortunately is not one of them, but virtual school is available free for a lot of people in other states. And I think that's something that would have been great if we had that here. Making sure that technology, internet access is a right for everyone is something that I think we need to work towards and lobby for, because it's clear it's necessary. I wish there was a way to get the iPad equivalent or something like that available for all patients who actually had chronic health conditions, so that they can connect virtually with their physicians. And so those are things that if everyone had access, then we can actually do a better job making sure we deliver care that's needed in a timely manner, as opposed to, patients getting to the desperate point where they show up in the emergency room. So, those are some of my thoughts. I'm hoping that people can share their experience with telemedicine. Has anyone in the audience had a virtual visit with their doctor? What was it like? Is anyone willing to share?
And if anyone's willing to share, you can either unmute yourself and ask, you can type it in the Q&A box, you can use the raise your hand feature. We can help facilitate that.
If no one's willing to share, Candace, I know you specifically have had a virtual visit.
So I would be willing to share.
Okay.
I think that I had to do it with my brother, who is 76 years old, or was 76 years old. And it was a medical visit with his physician. I found it okay, but I think he found it rather uncomfortable. And I think one of the challenges was not communicating with the physician, but was really, he had a particular complaint, and it was really difficult. And because I do have some health care, I was able to palpitate and so on and so forth. But I found it very difficult for a patient or an individual to do this on their own and talk about, well, I hurt over here, back here, and so on and so forth. And I was able to maneuver my iPhone, and he doesn't have an iPhone or any kind of Android, and move it around so that I can show where, there was some swelling and some tenderness and so on and so forth. But without that, I found it I was rather skeptical at the end, with individuals like this who are undereducated, and not able to really articulate what they're feeling without showing the physician or the caregiver, correct? And so that's my experience. And he had his healthcare was through Medicaid or Medicare. I'm sorry, Medicare, and it was exorbitant, the cost. I mean, because it took us a little extra time than a regular doctor's visit.
Oh, wow.
It was, I mean, because, you know, he was like, no, over here. And, you know, the doctor was like, can you move that over there? Can you touch this? Let's see what this side looks like. It took us about a half an hour.
Wow.
And it was pretty costly. Not that, I mean, his copay, just had to take care of his copay, but I was amazed at what the charge was.
Yeah, I mean, there's a lot lost, right, through video. I'm still getting used to it. And, you know, there's a lot to be said to be able to sit in a room, look at a patient, and try to help them explain what's going on with themselves, especially when they have physical complaints. You can examine, you can help, you know, refine your questions based on the exam findings. And so it is suboptimal for many patients with complex chronic diseases. Candace, I'm going to call on you. Are you there?
Hi, yes, I'm here. I'm here. I'm sorry. Could you, because I lost signal for a minute. Can you?
So tell me what your virtual experience was like.
You know what? It was actually very pleasant. It was very easy. And I actually didn't feel as if I was, you know, doing virtual, because it was simple. It wasn't a hard process. And, you know, but it still felt efficient, you know. And so if anyone is concerned about, you know, the efficiency or security, I still felt secure because there are security protocols in place. And I still felt as if I was having that one-on-one experience. So, you know, with that being said, if someone is questioning whether or not that's something that they would want to do, I would encourage them to try it.
Yeah, and
I
think that also, you know, having having a relationship with the person on the other end probably makes a difference too.
Oh, absolutely. Absolutely. Because you definitely, you know, having the relationship and knowing that you're talking to someone that understands, you know, someone that knows, you know, what your last experience was, so that when you're talking, you're not having to repeat. Because sometimes it can be frustrating when you have someone that doesn't know you. They haven't seen you before. And so they're asking you questions all over again that you've already answered. And so especially if the call is about results or something that you've been experiencing, then it's like, okay, I've already done this already. So it can be frustrating and challenging. So having that relationship with someone already, and then it builds the trust factor too, because it's like, you know what, I trust you because I know that you're not going to put me in a position that would be harmful, or, you know, with my privacy, it wouldn't do anything to disrupt my privacy. So I think having that relationship and knowing that the person that you're talking to already knows you. So when you talk to them, you're talking about your results, or you're talking about what your last experiences were, how you're doing now, and then what you can do in the future to either feel better, or if you need to, you know, come back in, if you need to change your diet. So it's just something that would be helpful to know that you already have that relationship.
Yeah.
Dr. Hong, this is Henrietta again, who just shared a few minutes ago. And I think that's a wonderful acknowledgement. I think individuals like myself would have that kind of experience, right? But I think the underserved and the vulnerable do not have that. I mean, his physician, I just want to clarify, knew him. And I mean, we started out the conversation with a joke because we both had masks on, and he said he was my brother said he was Tonto, and that he was the Lone Ranger and I was Tonto, right? And we all laughed about it. I really think that it's something that we all have to get used to, of course. But at the same time, I really believe that we have to be sensitive, you know, to those who are not as capable and have the kind of necessary instruments that you mentioned, you know, to be able to successfully and feel comfortable doing this. So thank you.
And I do think that one of the, you know, I mean, this may or may not be within the scope of what CHEC wants to do, but it would be really interesting to kind of come up with ideas of how we can make things more culturally sensitive using video technology or telehealth medicine, because no one has really explored this. We take a platform, as with everything, we target white upper middle class America, and then we just kind of let it go into the world and hope that it works and catches on. And so, I'd be interested to know how we could change the delivery method or what we can do to make it more accessible and more familiar to people.
I think on behalf of the Community Steering Committee, this is something that of CHEC would be something that we'd like to maybe talk about so that we can make it better, for those, communities that we live in and that we share and that we try to voice.
Oh, absolutely. And this is Candace. I definitely encourage that, because we're all exploring this new opportunity to connect in a different way. And so I think it's important to have conversations, even at the initial visit, to talk to the patients about subsequent visits being virtual, so that they are aware, they are educated about it, and to help them become comfortable by ensuring them, that of the security, nature of it. And so, they can't be comfortable if they're not aware of it. So I think having more dialogue about telehealth and how it's helpful, and especially for those that fear it, they're not sure, and fear going outside, fear COVID. So, fear right now seems to be happening all across the board. Fear of COVID, fear of, health, hospitals and things like that. And so I think this is smaller on the scale and something that we need to encourage people not to fear.
Yeah, and one of the things that I did early on, just because it's my own personal experiences, I personally find technology can be incredibly frustrating and challenging. And so in the beginning, I told my patients, so, we're going to see how this goes. If the video doesn't work well, I'm going to contact you through a telephone, and we're just going to have a telephone visit. And so, so that people didn't feel like, well, that was just a waste of time. Like I could barely hear her or see her. And so, understanding that there are limitations to technology, limitations that patients can't control, and realizing that, there's only so much we can try to accomplish, and making people not feel like, well, gee, I don't have the right equipment, I can't talk to my doctor anymore.
Absolutely.
We also have another question. Someone has their hand raised. Dolores, did you want to go ahead and ask your question?
Yeah, I had a comment about that. People share the experience, that kind of contact with a doctor. And they told me sometimes it's not very pleasant experience, because in our communities, we have so many families living in the same apartment. It's not privacy.
Right.
And sometimes when you talk to the doctor that way, you say half whatever you want to say. And because it's sitting around, everybody here, wherever, even people sitting so comfortable next to you to see the doctor. Because Latino community, usually when they go to the doctor in person, they take grandma, ma, everybody to the doctor, but they want to do the same thing at home, when it's through that way, everybody sitting in the sofa, try to meet the doctor, everybody say hi to the doctor and sitting there next to the patient. And that is very uncomfortable for the patient, because they don't have privacy about explaining what happened. And the other phenomenon we see is like people call to their own country to see a doctor or to speak to the doctor. And this is a big issue, because you don't know that the person in the other line is really a doctor, and they prescribe medication, but the way they prescribe medication, you need to buy it for them. They send it to you. And it's another more cheap way that people do it. That way, it's very complicated issue, like I don't know how to deal, but it's a lot of issues around that kind of method to do that. And that way people use alternative medicine in other countries.
So that's an important point, is one, making sure that people have a private space to talk. you know, I think that that is an important point, which I don't think I've, you know, every time I've had a patient encounter, it's always been one-on-one, but I do think it is important. And what a lot of, so I know Miles Square UIC is doing this, and I'm sure other places are going to do this, is for patients who don't have the internet technology, but still need to have a virtual visit, they can actually check into the clinic and have that virtual encounter. And so we're exploring trying to set up not telephone booths, but something like a telephone booth where you can go and actually talk to your provider without a in-person clinic visit for those who don't have the access and technology or feel like you need a private space.
Thank you.
Any other questions or comments? Does anyone have any personal or know of any experiences with cancer delays in treatment or concerns about that, that they have questions or just want to voice?
Dr. Hong, this is Kareem. One of the things that we've experienced here at Miles Square is really trying to have to get the message out to patients. We were really not surprised at all, but there's still a level of fear and mistrust that patients have with returning back to the clinic. Even for some of those visits, we've tried to let them know that we're prioritizing creating a safe space for them. Mm-hmm. We really have to have more of a concerted effort with community partners to let them know that there are efforts that clinics are taking. For example, one of the things we're trying to implement is what we call from the car to the clinic, from the car to the room, where we limit the amount of times in the waiting room that patients have to deal with, and but letting patients know that we're taking these things into a place, even having more Saturday hours, mm-hmm. so we can spread visits out as well, and also thinking about the Saturday hours for patients who may now be at home taking care of their grandchildren or even their children because of the at-home schooling. So those are other things to consider with the telehealth.
Yeah, and you know, that's important. I know that Miles Square is doing a lot. We're spreading patient visits far apart, making sure the rooms are scrubbed, cleaned in between every single visit. And you know, we are taking every precaution we possibly can. And communicating that certainly has helped a lot of people feel comfortable coming in. But you're right, there are a lot of people that we're not reaching. You know, I'm not sure when we're going to be able to start back up the Walk-in Wednesday, but that, you know, we diagnosed breast cancer through the Walk-in Wednesday program, and so I'm anxious to see it start up again, because I feel like there's a lot of women out there who probably need our services. Any other questions or comments? So telehealth and telemedicine is not going to go away. It's here to stay. I think the biggest issue is going to be making sure that everybody has access to this. You know, it's like having a telephone or having electricity or power. I feel like it's something that that every individual should have a right to have.
I agree with that.
So maybe we can lobby that for CHEC.
Yes, there's definitely a learning curve, and it's so important to have these conversations so that we really do just keep lifting each other up and holding one another accountable. So Dr. Hong, thank you so much for sharing your expertise and taking the time to educate all of us today. I know I definitely learned a few things. Just as a reminder, in the chat, we do have the website for the forum. There you can find, again, any resources, any details that the speakers mentioned will all be listed there at that website, okay?
All right. Thank you, everyone.
Thank you so much. Okay, so the next thing we have on our agenda, we actually have a poll, and you will be seeing that pop up on your screen shortly. We just like to ask about your experience with our virtual forum. So if you could be so kind as to fill that out, that would be greatly appreciated. And then we will move on to our raffle winner announcement. As you are filling out that poll, I'd like to let you know that we do have some upcoming virtual conversations that we will be hosting. Those links will appear in the chat also. And the slide is up here. It's letting you know which events we do have coming up. We have some in October, November, January, February, March. So lots of virtual events. We'd love for you to come be a part of them. Again, you can find those details on our website or through our social media pages. Okay, and with that, I think it is time to announce our raffle winners. They are Maria Perez and Lucy Groders. Maria and Lucy, please keep a lookout in your emails. The ChicagoCHEC team will go ahead and contact you within the next week or so. With that, I would just like to thank everyone for joining us for our first ever virtual community forum. We do want to take a moment to thank all of our community partners who work tirelessly to spread on-the-ground resources in our communities. And we also want to give a special thanks to all of our speakers for the valuable information they have shared with us over the past 2 days. Now, it is my pleasure to introduce to you Dr. Terry Mason, retired physician, public health official, and champion of community medicine, for closing remarks.
Thank you so much. Let me first say, make sure I'm not muted here. I don't think I am. Let me say that I thought this was an amazing meeting. It reminds me, and I heard Dr. Watson on the program earlier, but it reminded me of the meetings that this has been put for some time. That I remember chef meetings were going on back when Sean was at Northwestern, and I'm really glad to see that this meeting is continuing on in this multidisciplinary way, starting with the introductory remarks by Chancellor Delgado. And what has happened over time at at Malcolm X, in terms of the explosion of their health program to allow people who may not choose a 4-year program, but have an opportunity to enter into the healthcare system. Moving on to talk about just mindfulness. It's something that we forget, those soft skills that are important, things that we have to take into consideration how we're feeling, because we too often impose the way we feel or think on other people without providing them a space to have that conversation. So I thought that was real. I mean, just every speaker was just outstanding. I wanted to just, and Kareem, if you're still on, and many of you know me, I'm really an advocate on the dietary piece. And I was really happy to hear the focus on plant-based eating, which was just amazing to me. I almost fell out my chair.
Dr. Mason, I thought you would be excited with that. I was smiling from, you can't see me on the screen, but I was smiling from ear to ear. And that was intentional that they did the focus like that this year, because it also came from a community request. People, our community members wanted to know, we want to think about the nutrition piece of it. So thank you for that.
Yes, and even people undergoing cancer, chemotherapy, and treatment also suffer from sarcoplexy. I mean, they lose so much of their muscle mass oftentimes. And what we do is we tell people, oh, just drink another can of Ensure or something like that. So I'm glad to hear that we're really looking at this in a far more serious way and providing this opportunity at the Wellness House for people to have a place to come and learn and be taught in a non-threatening sort of way, and not be told, that they just need to eat more, to just drink more of these things, not understanding the role that the treatments often have in creating these situations. And I don't know how many people have ever had to undergo chemotherapy or even radiation therapy, depending on what they were getting radiated. But oftentimes you do lose your appetite. So I'm really, really glad to hear that you have this very nicely integrated approach. Your speakers were right on point, and I listened to every single one of them, and just because this is so important, and I hope that this was recorded so that other people could take advantage of a later time. So I really, really want to thank you. I didn't maybe mention everybody by name, but just an amazing program. And I really, really hope, I'd like to be able to refer people myself. I don't know if it's possible to Wellness House, because this is so key to getting people to understand the role that food can play, physical food can play in their mental and spiritual recoveries. Were there any questions? Well, having none, thank you so much. Really, really thank you so very much. Wonderful program.
Hi, I'm sorry, Dr. Mason. I'm sorry, I couldn't get off mute. I'm so sorry. This is Candace Henley.
Okay, how are you?
I'm good. How are you? You look awesome.
I'm like a drum with a hole in it. Can't beat it.
So oftentimes, me being a colon cancer survivor, the biggest issues that we have in terms of dietitian is finding dietitians that actually know how to treat colorectal cancer patients. And so often we're being told that we need to eat more fiber or eat more vegetables. And we're like, especially with someone like me who, I don't have a large intestine anymore, that can be very challenging. And so that's usually the biggest issue, with this disease, is having a dietitian or finding a dietitian that's actually well-versed for colorectal cancer patients. So that's usually the challenge with us in this community. And with that being said, what would you recommend, for dietitians to learn that we're not, all cancers are not one size fit all. So you can't treat this cancer the way you treat breast cancer, especially knowing that there's a digestive disease.
Yeah, I think that what we need to be sure about is that our dietitians understand the change in the normal physiology. So if a person has had a large segment of their colon removed, or maybe the total colon removed, that is a different sort of physiology that they have to think about in terms of what function now did that colon, when it was there, provide that no longer it provides. And there's a lot of things that have to happen. And so I think it would be important for dietitians to have an opportunity to speak with the oncologic surgeons to get them to understand first of all, just the physiology, just how the bowel works. and what the role the small bowel have, the stomach, the small bowel, and the large bowel or colon have, and what we need to think about based on how much of the colon is removed. Because, for example, the colon plays a major role in reabsorption of fluids and other chemical constituents in the colon. It also plays a large role in the promulgation of healthy bacteria for the human body, and it also plays a role in making certain that these particular functions are somehow, if we can't duplicate them, that we have to think about what we're going to give people, the transit time through their remaining GI system, what that means, and what metabolic abnormalities are they likely to face because of the loss of some of this absorptive colonic space. So I think it's a great question, and I think that we need to sit down with some people who have been looking at this problem for some time and see what we can glean from them in terms of helping to aid these patients, as well as listening to what some of the patients say in terms of just where they are even before they start they're going down this journey so that they understand the difference in their digestive system, since that'll happen after the surgery.
Thank you. Thank you.
Thank you so much, Dr. Mason, for your
You're so
inspirational
welcome.
words. And thank you for taking the time to answer that question.
Oh no, it's important.
Absolutely.
That's an amazing question.
Thank
And as
you.
she was asking it, I just thought about what it meant based on how much of and what part of the colon was resected or taken out or radiated, or the effective chemotherapy, oral chemotherapy and or intravenous chemotherapy on the bowel, and that ability for digestion to take place, that unfortunately people operate in their silos so much that they don't get a chance to think about how something impacts something else. So you got to have surgeons and nutritionists, and although surgeons don't know much about nutrition, I can say that as a past surgeon. But we need to sit down and look at just what the alteration in the physiology is, so we could better counsel the patients.
Thank you.
I'm sorry, Selena. This is Henrietta. I just want to comment, Dr. Mason. I want to just say thank you. And for Candace as well for bringing this up, because it's given me a different perspective, right? And as a member of the Community Steering Committee for CHEC, I think this is something that we have to kind of look beyond just informing our clinicians. I think it's something we have to inform, as you mentioned, our community. I think if individuals are more, especially those vulnerable communities, where if they understand, perhaps we would have, more positive outcomes as well as besides treatment and early detection, but also follow through and eating right while we are trying to get healthy. So I want to say thank you. I'm taking one thing away. I'm taking many things away, but this really strikes a chord, and I want to say thank you very much for your time.
Oh yeah, and I think I'd be willing to help with with this, because I think this is a critically important point in terms of the role that these surgical alterations create from a nutritional point of view. So it's important that before the surgery, that the patient, and perhaps maybe working with Wellness House, the patient should have a pre-surgical or radiation or pre-treatment consultation, and given a chance to understand, based on how much of her colon or his colon is going to be removed, what alteration just that's going to have, even before we get into food. And then what do we do to try and get our bodies to readjust to this new anatomy, and understanding what things are absorbed in what parts of the colon or the GI tract. What do we need, or how do we need to supplement these in the event that they're not? So I think it's a critical question, and we really do need to get our medical oncologists, radiation oncologists, and surgical oncologists engaged in this conversation.
Thank you, Dr. Mason.
Thank you, everyone. To all of our speakers, your expertise has been invaluable over these last 2 days. At this time, I would like to turn it over to ChicagoCHEC leadership for our closing remarks.
Hello, it's Lydia Philus, and I'm one of the PIs on this grant. And I know that it's already after time and everybody is trying to get time for weekend, but I want to be brief and wanted to thank the Community Steering Committee, also the Community Outreach Corps, ChicagoCHEC staff, and also all the presenters for organizing and putting together such a wonderful event. For us, the leaders, it's again something that enforces us to listen. It's another lesson, listen, because the leaders who do not listen are surrounded by people who have nothing to say. And you have a lot to offer and a lot to say. Therefore, there is nothing else for us but to listen. Thank you so much from all of us.
That concludes our session for today. Thank you so much for spending these last 2 days with us. Again, please check out our website for any details on upcoming virtual conversations. We are inviting you to please come and participate and be a part of them. Hi, Dr. Simon.
Dr. Simon, do you want to say a word?
I just want to say I love you all. I think you did a fabulous job the last 2 days, and thank you to everybody. It takes a village, and as everybody said throughout these last 2 days, we are all together. We are all connected, and I really want us to remember that. The other big thing is vote. Do not forget to vote. Our vote is our voice. Please, and be well. Thank you.
Thank you, everyone, and that concludes our day. Bye.
Thank you.
Thank you, everybody. Be safe.
Thank you so much, everyone. Have a wonderful and safe weekend.
Thank you.
Thank you.
Thank you.
Mm-hmm.